Hello, I am Maxime Thibault. I am a pharmacist working in clinical informatics at C26 in Montreal. This work was done in collaboration with Pierre Snell and Audrey Durand from Université Laval and Milan. In North American hospitals, pharmacists caring for hospitalized patients review the lists of active medications, what we call pharmacological profiles, for the patients under their care to identify potential problems and plan interventions. However, in practice, problems are rare. The time spent reviewing orders without problems has been described as wasteful and as a potential safety issue. There is an opportunity to devise a triage system that would be able to filter out profiles without issues from pharmacist review so that pharmacists could focus their attention on patients more likely to benefit from their expertise. To explore the feasibility of creating such a system, we used a dataset composed of all medication orders from 2005 to 2017, with the year 2018 as a test set. We represented pharmacological profiles as multi-hot vectors. The dataset does not include labels as to the typical or atypical nature of orders or profiles, and for this reason, we selected an unsupervised autoencoder-based GAN technique focused on anomaly detection, namely GANomaly. We modified the model structure and losses to accommodate our data and to stabilize training, which resulted in this model. Previous work suggests an important effect of data drift through time on this type of data. We examined this by progressively increasing the training data volume up to 10 years with threefold cross-validation and observed no such effect. On the test set, we observed that patient populations with more predictable order patterns, such as neonatal intensive care patients and OBGYN, showed lower encoder losses, and that populations with more complex profiles, such as pediatric intensive care, long-term care, and oncology patients, showed higher encoder losses. We sampled 50 patients per department and qualitatively observed that profiles with low encoder loss seem to correspond to routine orders less likely to benefit from extensive pharmacist review. In conclusion, this model shows the potential for the identification of atypical pharmacological profiles. However, we only performed unsupervised training and evaluation at this point. We are currently evaluating this model in a prospective study by comparing predictions with the evaluations of profiles made by pharmacists in clinical practice. Thank you for your attention. Do not hesitate to contact me if you have any questions or would like to discuss our work.